Good morning. Thank you for coming in the morning to hear all about UNICEF's progress on gender equality. I'm Anju Malhotra. I'm Principal Advisor, Gender Equality, Gender and Development at UNICEF. In the last year, in 2016, UNICEF's work on gender equality was definitely informed by the new SDG agenda, which of course UNICEF contributed a lot to in shaping. And as we know that there are persistent inequalities for women and girls that continue, there are growing humanitarian crises which actually put women and girls even at greater risk and vulnerability, although there are opportunities there to sometimes rearrange gender relations. There's still quite substantial lack of data on gender, and even the data that we have isn't always utilized. And of course, financial resources are a major concern, and as we have other types of inequalities and competing priorities, resources and capacity isn't always directed to gender equality. That said, we have an amazing SDG agenda that puts women and girls in the center. There's not only a gender equality goal, but gender equality is embedded in all the SDGs. And most of them have a lot to do with UNICEF's work. So UNICEF has this fantastic platform on which to mobilize commitment and resources and action. And there is a global momentum among many countries where they realize that unless women and girls, half the population of the world, is brought into the mainstay of development, development is not sustainable or possible. As you know, UNICEF's work on gender equality is guided by our Gender Action Plan 2014-2017, which is synced with our strategic plan. And there are basically 3 program areas of work based on the Gender Action Plan. One, first of all, is the focus on empowering adolescent girls, which we have bundled under 4 targeted priorities: gender-responsive adolescent health, girls' secondary education, ending child marriage, and gender-based violence in emergencies. And then there is a focus on bringing gender into, mainstreaming gender into all the 7 outcome areas, from health to social inclusion. And finally, there's a strong emphasis on shifting UNICEF systems and cultures and processes to be able to deliver on gender results better, and that covers resources, staffing, capacity, systems, partnerships, knowledge, and communication. So to give you just a summary of the programmatic part, which are the first 2 areas of work, in the last 3 years, and I'll give you not just 2016 progress, but in general a sense of what has been happening in 3 years, because we're in the process of shaping our new strategic plan, and with it our Gender Action Plan 2.0, emerging from these results and the lessons learned over the last 3 years. So 2016 was a very critical year for us to really understand how progress overall, what has been the trajectory. So we see a growing set of UNICEF programs reaching large numbers of women and girls, with some areas such as maternal care, nutrition, and child marriage making tremendous progress. And that's a good sign, because we have tried not to projectize gender equality work at UNICEF, but make it as scalable and sustainable. There's an increasing recognition of the importance of strengthening systems rather than undertaking isolated projects. So more of our program is trying to change how governments work, the capacity of governments, how policies are implemented, and how at the local level those policies play out. And as UNICEF works growingly in emergency situations, having this Gender Action Plan, the GAP framework, has made our gender programming more responsive to emergencies, especially in providing water and sanitation and hygiene services and addressing gender-based violence in emergencies. To just give you a sense of how our country programs have really adopted and mobilized around gender equality results, In 2016, 88% of all UNICEF country programs included results on at least one or more targeted gender priorities focusing on adolescent girls. And 80% of all country programs included one or more gender mainstreaming result in their country program documents. Now, we'd like to see these numbers be 100%, but as you know, many times countries have to wait till their country program cycle comes up before they can change officially their results. And so we figure that by the time all the cycles are through, we will eventually reach 100%. So to give you a little bit more nuance on Program Area 1, the empowerment of adolescent girls, what do some of the results look like? They include 1 million girls reached in 11 countries with budgeted national strategies around child marriage. They include 4.6 million women, girls, and boys reached across 53 countries on gender-based violence. They include 41 countries in which UNICEF has been able to mobilize policies and action around adolescent girls' nutrition. Include 62,000 girls receiving cash transfers in India to go to school. 1,000 schools in which menstrual hygiene management programming facilitated girls' retention and completion of school. Adolescent HIV work in 28 countries, especially since girls are at higher risk of HIV acquisition. FGMC, 2 countries are now showing from our global program declines in FGMC. And adolescent pregnancy and care, 80% births with skilled providers in 54 countries. So those are, I think, quite substantial results, and we know that they're all very connected. As girls don't get married, they're more likely to stay in school. If they're more likely to stay in school, they're less likely to get married and be pregnant and be at risk of death or morbidity through pregnancy. In gender mainstreaming as well, we have some really good results. We have, of course, in key sectoral areas, especially things like water and sanitation, cash transfers, millions of girls being reached with facilities, healthcare centers where water and sanitation are very important for safe delivery and dignity for women and girls, pregnant women with HIV receiving PMTCT care and ARTs, antiretroviral, and now lifelong, not just during their pregnancy. In 70 countries, cash transfer programs, which are primarily directed at supporting women, since more cash in women's hands tend to go to children, and breastfeeding care. And in 2016 in particular, we focused on breastfeeding, not just as an issue that reflects children's nutrition, but women's dignity and women's ability to fulfill their maternal function effectively. And then, of course, in humanitarian crisis, we had things like Zika last year, a lot of community mobilization and messaging around Zika, reaching 162 million people. In Nepal, earthquake emergency also led to nutrition interventions. And then, of course, education for girls in emergencies is a major issue, since girls are 2 times more likely to be out of school in emergencies. Institutionally also, we now have our functioning regional gender advisors in all 7 regions. We have more countries acquiring gender specialists. We have gender focal point system much more formalized than it used to be, and UNICEF tends to perform better than most other agencies on gender parity in its staffing, especially at higher level posts, currently with 48% in P5 or higher level posts. More of our country management plans, 76%, have accountability for gender results. And of course, we have a very effective knowledge and communication sharing policy with large numbers of people reached through our messaging and advocacy around gender equality. We mobilize, as you know, so many partnerships as part of the multilateral system with UNFPA. We have some very important joint programs. We're part of H6. We're work together, Every Woman, Every Child, on health, maternal health, and children's health. We are function very closely with the Girls Not Brides Alliance to move the work on child marriage. So a lot of civil society partnerships and women's groups with UNICEF engages very intimately. On resources, of course, we have challenges with regard to gender resources, which many of you know has been a difficult issue to face. Gender resources primarily come from all the sectoral resources that are mobilized and institutional RR funds. And in the last year, the distribution, as you can see, was 11% regular resources, 51% other resources, and 38% emergency resources. Last year was the first year that Luxembourg donated $500,000 to UNICEF's Gender Thematic Fund. And although we have seen interest by many other partners and countries in contributing so far, that has not materialized, so we really encourage that interest to translate into thematic funds for gender. And as you know, even though the vast 80% of the funding for work on gender equality, we expect it to be part of health or education or child protection, we do need dedicated catalytic funds for gender equality to mobilize those things that sectors can't mobilize. Gender data, which cuts across cross-sectoral programming, and most of all, incentivizing sectors to actually spend the money on gender. Every time we put gender money in the hands of a sector, they're more likely to spend 5 to 10 times of their own funds to mobilize the work on gender when we bring something to the table and direct that programming in more effective ways. There are a lot of lessons learned from this 2016 and in the last 3 years. We know that we've made progress on many fronts, but there are a number of challenges remaining, resources not being the least of them, and also the measurement of resources continues to be a challenge, not just for UNICEF. Many other agencies and bilaterals also use gender markers and other tools such as gender markers to measure the amount of expenditures on gender, which are only semi-effective, and we are looking at a second generation of gender markers that we would like to discuss with you. Promoting cross-sectoral programming on gender still remains a challenge. As I said, collecting and utilizing gender data is something that is high on our list, and catalyzing innovative solutions. This year, at the end of 2016, we just launched the Gender Innovation Challenge for our countries to use some of the funding that we have in our hand to come up with more creative solutions to solving some of the biggest problems on gender equality. So I'll stop here because to just give you a sense that we will have some kind of an informal on the new Gender Action Plan, Gender Gap 2.0, as we go into the board week and the following week, and we look forward to further dialogue with you in building on the work that we have done and taking it forward over the next 4 years. Thank you.